Welcome to the series of online training modules on the crossover youth practice model. In this module, we will present information gathered during our outcome evaluation of the crossover youth practice model implemented in one of the counties in Minnesota. Our project team at the University of Minnesota School of Social Work includes Wendy Haight, Professor and Gamble-Skogmo Chair, Laurel Bidwell, Assistant Professor at the St. Catherine University, Choi, Postdoctoral Research Associate at Gamble-Skogmo Research Center, and myself, Cho, a PhD Graduate Research Assistant. We are grateful for the financial support of Cage Family Programs, the Gamble-Skogmo Endowment, and Federal Title IV funding through the Minnesota Department of Human Services and the Center for Advanced Studies in Child Welfare at the School of Social Work at the University of Minnesota Twin Cities. We have three main learning objectives for this module. After completing training, we would like our viewers to identify the key components of the crossover youth practice model, including its goals and the implementation process. Understand an outcome evaluation of the CYPM impact on youths in one Minnesota county. We will refer to this county by pseudonym, Oak County. We also hope that lessons learned from this study can be useful to those who are interested in implementing the CYPM specifically or cross-systems collaborations for crossover use more generally. Today, we are going to build upon our previous modules entitled Child Welfare and Juvenile Justice Among African American Crossover Youth. The crossover youth practice model, which was about the strengths and challenges experienced by professionals during the CYPM implementation. For those of you who haven't had the opportunity to watch our previous modules, we will offer a brief review later in this module to provide the necessary context. The information presented in this module is part of a larger mixed method evaluation being conducted in the Gamble-Skogmo office at the University of Minnesota School of Social Work. Some of you are already familiar with the term crossover youth, used in a number of different ways across different settings. In this module, crossover youth refers to youth who have experienced some form of maltreatment, for instance, physical abuse, sexual abuse, or neglect, and have also engaged in delinquency. As a result, they were involved in both the juvenile justice system and the child welfare system. It is also important to note that although youths can cross over in either direction, most often we see youths first showing up in the child welfare system and then subsequently crossing over into the juvenile justice system. In this slide, we are going to talk about some characteristics of crossover youth we know from previous research. We know that maltreated youths are 47% more likely to become involved in delinquency than youths from the general population. Child welfare involved youths are at higher risk for mental health, educational and vocational problems than those who have a history of delinquency only. Also, these risks can be increased by experiences that they have within the child welfare system, including multiple moves while in out-of-home placement. In addition, involvement in the juvenile justice system can further compound youth's risk, for example, through exposure to delinquent peers and stigmatization. Previous research has also shown that child welfare involved youth in the juvenile justice system receive harsher treatment. For example, they are more likely than non-child welfare peers to be placed in group home or correctional facility instead of receiving probation. They also show more recidivism and re-referral for child protection services, as well as higher rates of criminal involvement as adults. Based on these previous research results, we know that crossover youth are at high risk for negative developmental outcomes, and they are also involved with multiple systems throughout the course of their lives, including the child welfare system, juvenile justice system, special education at school, mental health services, to name a few. However, these systems are typically not coordinated, and each has their own set of complexities, perspectives, languages, mandates dealing with those issues that affect crossover youth face. Clearly, effective approaches are needed to change negative developmental trajectories and support positive development for crossover youth. In response to this need, members at the Center for Juvenile Justice Reform at Georgetown University developed and published the Crossover Youth Practice Model. They teamed up with case family programs to provide trainings for this model, to be implemented in sites throughout the United States beginning in 2010. At the time of this study, the crossover youth practice model has been implemented in 88 counties in 20 states. We are going to review the key components of the crossover youth practice model. The CYPM is a practice model. The authors state that they intend to provide a conceptual map and organizational ideology that includes definitions and explanations regarding how staff can partner with families, service providers, and other stakeholders in the delivery of services to achieve positive outcomes for youth and families. The CYPM provides a guide to cross-systems collaboration, especially between child welfare and juvenile justice professionals, but also mental health, education, and other professionals involved with crossover youths. It also provides a guide for engaging families. The overarching goal of the CYPM is to reduce the involvement of maltreated youths in the juvenile justice system. This model brings together best practices from both the child welfare and juvenile justice systems, integrating a strengths-based perspectives to service delivery. There are 3 phases of implementation of the crossover youth practice model. The phase 1 has to do with the arrest and identification of crossover youth. Decisions about detention and charges are made at this phase of the CYPM implementation. This phase also includes planning around information sharing. For example, developing MOUs to facilitate the process of information sharing between juvenile justice and child welfare professionals. Phase 2 focuses on joint case assessment and case planning, as well as consolidated court processing to handle delinquency and dependency hearings together. Phase 3 leads professionals through a process of ongoing case management, family engagement, and planning for case closure and permanency. These 3 phases are not always implemented in one particular sequence. They are intended to provide a structure and series of decision points. The important thing to note here is that professionals working in different systems and families are communicating regularly, sharing information possibly for the first time, and planning together around what is best for the crossover youth and his or her family. If you are interested in more detailed information about the original CYPM guide, here is the link for the website to the CYPM manual. Click this box. A number of the internal reports from the initial 13 implementation sites suggest that The practice model is having a positive impact on reducing the number of youths who cross over, reducing congregate placements and recidivism, improving permanency planning and youth's contact with family and other supportive adults, improving youth involvement in pro-social activities, and improving mental health. A recent ethnographic study of the CYPM, which is also part of the larger mixed method external evaluation, including the current study, examined experiences of child welfare and juvenile justice professionals during the first year of CYPM implementation. In the study, professionals described positive changes in the system's structure and psychosocial aspects. From their experiences and perspectives, the CYPM implementation improved services to youths and their families. It also led to improvements in procedures and legal mandates for sharing information across departments. Regarding psychosocial changes, CYPM strengthens relationships with other professionals and results in positive shifts in professionals' thinking and feelings about youths and families. Another study of the CYPM implementation found that there are multiple aspects of family engagement. First, CYPM implementation leaders mostly discussed the logistics of when and how to engage families. On the other hand, frontline workers discussed many relational aspects of engagement, including trepidations around the impact of cross-system sharing of information on their ability to establish trusting relationships with families. Also, interviews with families themselves focused on relationships. For youth and caregivers, the quality of their relationships with frontline workers was crucial to their experience. For example, their perceptions of whether or not they were treated fairly was closely linked to their descriptions of workers' characteristics, such as willingness to listen. Findings also suggest that for African American families, there are more distrust experienced at the systems level than for Caucasian families. The ability to form a collaborative relationships with frontline workers was especially critical for those families. In this study is not yet published. However, you can get a little bit more information from the abstract of the study. If you are interested in this study, click this abstract box. In September of 2011, the Center for Juvenile Justice Reform at Georgetown University, Case Family Programs, and the Juvenile Justice Coalition of Minnesota partnered in training 5 Minnesota counties to implement the crossover use practice model. Oak County is one of the 5 counties and the focus of the current study. To achieve the first learning objective, now we are going to look at the evaluation of CYPM outcomes. The purpose of this study is to examine outcomes for youth participating in the CYPM in Oak County compared to youth who did not participate in CYPM in Oak County and its neighboring counties. We investigated 5 hypotheses. The first hypothesis is that CYPM youths will have fewer adjudications. For example, youths participating in CYPM will receive more stays of adjudications and dismissals than adjudications. In this study, adjudication refers to a finding by a judge in juvenile court that has a youth committed a violation of the criminal law, that is a delinquent act. Stay of adjudication refers to a conviction for an offense is not entered on the individual youth's criminal record. The individual youth offers a guilty plea to the court, but the court does not accept it. There is then a probationary period set with certain conditions. If the terms of the probationary period are met, the case is dismissed at the end of that period. Dismissal means that the individual youth's criminal record is clear of any convictions, that is, the criminal charge is terminated. The second hypothesis is that CYPM youths will spend less time in out-of-home placements. Third, fewer CYPM youths will be placed in congregate care settings, such as group homes, resident treatment center, and correctional facilities. The last hypothesis is that CYPM youths will have fewer subsequent delinquent charges. In other words, CYPM youths will have less recidivism. Data were obtained through the MinLink project at the Center for Advanced Studies in Child Welfare in the School of Social Work at the University of Minnesota. All the identified data were provided under data sharing agreements with each of the agencies. For the purpose of this study, we linked state-level data from the Minnesota Court Information System with the Minnesota Child Protection Administrative data, which is part of the Social Service Information System, and the Minnesota Automated Report Student System of the Minnesota Department of Education. Link Plus, a program developed by the Center for Disease Control and Prevention, was used to match each child's record by date of birth and first, middle, and last names. To examine the 5 hypotheses, we used a quasi-experimental post-test only design with independent pre-test and post-test samples. We created 4 groups, 1 CYPM treatment group and 3 comparison groups. You can see those groups in this table. Youths from all groups were maltreated and subsequently became involved with the juvenile justice system. All were followed for 12 months following the target offense date. T-post indicates the CYPM Oak County treatment group and was comprised of dually involved youths from Oak County who received CYPM services between January 2011 and August 2013. T-PRE means Pre-Treatment Oak County Comparison Group. This group was comprised of dually involved youths from Oak County who received services as usual prior to the implementation of the CYPM, specifically between June 2008 and December 2010. Likewise, for the neighboring county comparison groups, C-post indicates post-treatment neighboring county comparison group. This group was comprised of dually involved youth from 6 different counties that share borders with Oak County and who received services as usual between January 2011 and August 2013. And C-PRE denotes their pre-treatment group. Here's some information about study sites. The CYPM treatment group was drawn from Oak County. Oak County is a large urban county in the upper Midwest. It is home to over 1 million residents with a population density of over 2,000 per square mile. More than 12% of residents live below the poverty line. Nearly 29% of residents are ethnic minorities. Neighboring county comparison groups were drawn from 6 counties sharing borders with Oak County. These counties ranged in population from 21,000 to 527,000, with population density ranging from 80 to 3,000 per square mile. Residents living below the poverty line ranged from 5% to 16%. Residents who were ethnic minorities ranged from 7% to 48%. The Oak County treatment group consisted of 57 crossover youths who participated in the CYPM between October 2012 and August 2013. 54% were male and 75% were African American youths. The mean age at the time of the target offense was 14 years and 8 months. 88% were from low-income families. 74% were eligible for special education, and 61% had been neglected. This study was designed after Oak County had already begun to offer CYPM services, so we were not able to assign crossover youths to treatment and comparison groups randomly. To minimize this limitation, we used propensity score matching to identify crossover youth who had similar characteristics with the CYPM treatment group. Propensity score matching is a statistical technique which is used to better equate treatment and comparison groups by matching on a set of participant characteristics such as gender, ethnicity, socioeconomic status, etc. In this section of the module, we will look at the result of the CYPM outcome evaluation of Oak County. This study result did not support the first hypothesis. In multinomial logistic regression analysis, we found that the treatment group was not significantly different from the three comparison groups in the types of sentences received after controlling for time and local effect and the other covariates. The second hypothesis was not supported by the study result. In other words, we found no significant differences in the expected number of days placed in out-of-home care across groups. Over the 12-month period following the target offense date, approximately half of all youths were in out-of-home placements with means ranging from 181 days to 258 days. Next, for the third hypothesis, we examined the probability that crossover youth will be placed in congregate care. In this study, congregate care includes group homes, residential treatment centers, and correctional facilities. Among 19 CYPM youths in out-of-home placements at the target offense date, approximately 84% of the youths experienced congregate care within the next year. Logistic regression analysis on youths in congregate care indicated no significant difference between treatment and comparison groups after controlling for the effect of time, local, severity of offense, and type of home placement at the target offense date. So, this study result does not support the third hypothesis. Finally, this slide shows the CYPM outcome regarding recidivism. During the year following the target offense date, approximately 32% of the Oak County CYPM treatment group youths and an average of 48% of the three comparison group youths had one or more additional criminal charges. In logistic regression analysis, we found that there was a significant difference between treatment and comparison groups in recidivism after controlling for the effect of time, local, severity of offense, and type of out-of-home placement. So, this study results support the last hypothesis. This is a summary of this study. This study is an external outcome evaluation of the CYPM first full year of implementation. CYPM is an intervention targeting crossover youth to minimize the involvement of maltreated youths in the juvenile justice system. we found that crossover youth's involvement with the CYPM did not reduce their risks for adjudications or congregate care placement. However, this study suggests that the CYPM may be an effective approach to minimizing the risks to maltreated youth's development through minimizing their involvement in the juvenile justice system. The study findings are consistent with the perceptions of professionals working within Oak County and other counties where the CYPM has been implemented in the previous study. The professionals expected the CYPM implementation to bring positive outcomes for crossover youth, as crossover youths are identified earlier and their families are more promptly receive more appropriate services. Alternatively, it is possible that once they are targeted as a crossover youth, CYPM youths are not being charged but are being diverted from juvenile justice involvement, and then they got into social services at the time of their subsequent delinquent offenses. In either case, CYPM practices may be better targeting the underlying reasons for CYPM youth's delinquency, which may result in less recidivism. Considering these study findings and limitations, we recommend that more research is needed. First, we evaluated the impact of the CYPM during its first full year of implementation. The Child Welfare and Juvenile Justice Departments of Oak County are large and complex. System change and the subsequent impact of such change on clients do not happen quickly. Future research should evaluate practices related to adjudication and congregate care placements again after the CYPM is better established in the county. Second, this study is limited to the existing administrative data. We obtained specific information for individual youth by linking currently available administrative records with a focus on Child Protection Service status and public school enrollment. So, future studies should consider other important youth outcomes, such as school engagement and achievement, and mental and physical health. Third, we did not have access to police data that would have allowed us to evaluate primary goal of the CYPM, which is the immediate diversion of youths from juvenile justice involvement. Our use of the juvenile justice courts data meant that we only had access to youth who had already touched both systems. Subsequent research would be enhanced by access to police as well as courts data. Thank you so much for your interest in this topic. We are excited to being moved into our next steps in talking about early indicators that predict entry into the juvenile justice system from the child welfare system. Stay tuned. We look forward to sharing our findings in the future modules. Now we are going to discuss the third learning objective. There are a variety of lessons that derive from this study. For example, this study may sensitize workers and administrators to the importance of building relationships with youths and families to engage them in services. Sensitivity to relationship issues, such as trust, can enhance youths and families' engagement in the services. As this study found, the crossover youths who received the CYPM services showed less recidivism. Your efforts to building trusting relationships with them may contribute to bringing about positive outcomes to youths and families you work with. You may consider, first, how do you interact with youths and families? What about your colleagues? Second, Are relationships with youths and families central to your practice? And that will be your colleagues. Third, to what extent do you think your sensitivity to relationship with youths and families facilitate their engagement in service? Fourth, to what extent and how might you and your colleagues prioritize strengthening relationships with youths and families? Another lesson one might take from our study concerns the importance of establishing professional relationships with colleagues working in other agencies to enhance cross-system collaboration. Collaboration with professionals from other systems can help you have more information about youths and families, which can lead to promptly identifying crossover youth and providing more appropriate services. You may wish to consider, first, to what extent do you interact with professionals from other systems? Second, how effectively do you view your ongoing communications to address protocol changes, troubleshooting cases, and refresher trainings? Third, to what extent do you think the interaction among professionals across systems influences youths and families? Fourth, how might such communications be strengthened? Lastly, you may wish to consider advocating for implementation of the crossover youth practice model in your own jurisdiction. This module provides a list of references that provide more resources for the crossover youth practice model. If you are interested in the CYPM implementation in your own jurisdiction, you can get some resources and connections to professionals or experts who are familiar with the CYPM implementation. You may wish to consider, first, to what extent and how do you think the CYPM can be beneficial to your own jurisdiction? Second, what do you think you need to prepare for the adaptation of the CYPM to your own jurisdiction? For your information, here are a list of references cited in this module. And here is the list of credits for the images used in this module.